I'm now joined by Brother Usman. Assalamu alaikum and a very warm welcome, Usman.
Assalamu alaikum, Brother Jawad.
How are you? You okay?
Thanks for being on the show and supporting this vaccination program again.
No, anytime. Usman, before we ask what is going to happen on 1st of April, tell us, how was the last COVID vaccine hub? How was the response from the community?
Yeah, alhamdulillah, we had a great response from the community. Very supportive, very successful. Every single vaccine that we had allocated for the day was used. So very successful. We had a lot of media attention as well. And alhamdulillah, very successful day.
Excellent. Good to hear that. Because obviously, there was some concerns after the reports about Oxford AstraZeneca blood clotting. Still, our community is okay. Overall, people are okay, and they are still willing to take that vaccination.
Yeah, alhamdulillah, we progressed quite far from the initial concerns that we had. So we've seen a marked increase in uptake, and that's been observed across the practices in the city, particularly from the BAME community at large. But, we still do have some question and concerns about it, and rightfully, there have been some cases of the blood clots, which, although are clinically insignificant and people really don't have anything to worry about, but, they're rightfully, to ask the questions, and rightfully the clinical teams are advising them on the importance of getting vaccinated as well.
So when somebody comes and they are not confident, if they are worried, they need to ask any question, who's there to answer their questions?
Yeah, so we have the clinicians on the day, so we have the doctors and the nurses who will be on site. But alongside we also have the imam, who, if there's any fiqh-related or Islamic context regarding the vaccination or anything to query, then they can sort of answer the questions. Likewise, we have volunteers on the day who can help to translate in various different languages, whether it's Urdu, Punjabi, Bengali, and so on. There's interpreters there as well to assist.
Okay. So now tell us what's happening on Thursday, 1st of April.
So given the success of the first vaccination hub, the doctor, the clinical Jasam Chetty has agreed for a second hub session to sort of build the momentum on the previous vaccination hub. So this Thursday, the 1st of April, between 2:30 and 5, there'll be another vaccination day at Makki Masjid at Plantation Road. So we're just hoping that we sort of encourage the community to come along and get vaccinated if they're eligible and they haven't had the vaccines yet.
And what is the eligibility criteria? Who can come?
So this time, the vaccination eligibility criteria has improved a little. So in terms of the age limits, this is now the 50 plus age group. Last time it was 65 plus, but now, if you're age of 50 plus, regardless if you have any medical issues or medical problems or not, you would be eligible for the vaccine. Similar to last time, in that frontline health workers, social care workers, care home workers, they will still also be eligible. And likewise, anyone who's 18 plus and in a clinically vulnerable group, so anyone between the age of 18 to 50 who's in a clinically vulnerable group, for example, morbid obesity, severe mental health illness, is a registered carer or a non-registered carer for someone, then they will also be eligible. So the basis of the vaccination program is for the Healy Plus network, or the Healy Plus primary care network, which is a list of different surgeries, including Shadow Lane Medical Centre, Veritas, Matthews Practice, Caulfield Medical Centre, Healy Green Surgery, Bleedless Medical Centre, both the Stones Medical Centre, and the Abbey Lane Topley Surgery. But if anyone is outside of those surgeries and they were to turn up, they would still be considered, we wouldn't be turning anyone away.
Mm-hmm. And which vaccine you guys will be using? Is it Oxford AstraZeneca or Pfizer?
Yeah, it will be the Oxford AstraZeneca vaccine. Mainly, as you mentioned before, clinically, they're both as good as one another. But in terms of transportation, the Oxford AstraZeneca is you were able to transport that from one site to another. Where the Pfizer is quite limited in that with the minus 80 degrees temperature requirement.
And Usman, tell us, is this a walking service or do we have to book an appointment to attend?
Yeah, so same as last time in that it is a walking clinic. There's no need for an appointment. So literally as you walk in, there'll be a case of us taking your details. Once we've taken your details, you'll be allocated a space inside the hall. And one by one, we'll be then calling you through to get vaccinated. There will be a multitude of different clinicians there, both male and female. So if someone is a female, they want to see a female, or a male wanting to see a male clinician, then we can facilitate that as well.
Okay, excellent. Another question I wanted to ask, but I can't remember now. Okay, if you can tell us about this vaccination hub site, please, where this is taking place, what time, and when?
Yeah, so the vaccination hub will be taking place this Thursday, the 1st of April. That's starting from 2:30 p.m. till 5 p.m. And that's at Masjid, which is on Plantation Road, and that's Sheffield S890H. And that's just off Chesterfield Road.
Okay, I think I remember now. And am I right that this vaccination is for those who need the first dose, not the second one?
A slight adjustment this time in that, as well as the people who have had the first dose, we can consider the second dose individuals, so long as it's been at least a minimum of 4 weeks. So with anyone who's had the first dose and it's been at least 4 weeks, then we can consider them.
You can.
Obviously, prioritize the people on the first dose, but because from last time we'd seen there was a number of people who are actually still awaiting the second dose and they were eligible, so we've opened that up this time, but the priority, the focus will still be on the first dose.
First dose. Okay. Well, Usman, thank you very much for your time. I really appreciate and wish you all the best. And I hope this, hub service will be successful and the response from the community will be very good. Keep up the good work, and I think it's amazing. It's a great work from the community.
Yeah, and likewise, thank you for supporting us in the program. I really appreciate your work on the radio as well. Then
really appreciate. We are here anytime, whenever you need us. Thank you very much, Usman. Really appreciate. Allah Hafiz. Khuda Hafiz.